Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and we are nurse educators. You have tuned into our series In the Know, where we make it simple. Today we are simplifying testing tips.
We have something to offer you, whether you're writing the NCLEX, the NCLEX-PN, or the CPNRE exam, whether you're a registered nurse, a practical nurse, an LPN, whatever it is, we have some tips to share with you. Before we get started, we just invite you, as always, to subscribe to us. Wherever you are joining us from, you can follow our Facebook page, subscribe to our live video feed, as well as subscribe to our YouTube channel. That doesn't mean we'll inundate you. It just means that you'll be notified when we put out new content, which is multiple times a week. We have tons of information to share with you in terms of writing your registration exam. You can also visit our website at www.n-powermentnursing.com, where you can view all of our complete study packages, as well as download our free trial, which includes our full cardiac chapter.
It's always a good idea to look at study tips, anything that can help you. Study tips can sometimes be a go-to place when you don't know the answer. You can think back on your study tips, and this can be very helpful as a strategy to cope during those moments.
We want to make it clear that testing tips aren't a replacement for content review, but they are strategies to help you kind of in the moment. So we do have entire pages on testing tips in our full content textbook, which you can see is quite thorough. So we do have full pages, but we're going to kind of share with you some of our favorites that multiple graduates who have taken our program kind of use the most. So the first one we're going to talk about is considering the age of the patient. So when you read the stem of a question, it's really important that you pause for a moment and you think, how old is this patient? An example might be hypoxia in a respiratory patient. So any hypoxic patient, if you've taken our course and you're studying with us right now, you know the number one sign and symptom of hypoxia is restlessness. But restlessness looks very different in a toddler from how it kind of clinically manifest in an elderly person. For example, a toddler who is restless will be playing. But in the stem of a question, if you think, oh, the toddler's playing, they're not hypoxic, you would be wrong. Because if they're playing, they are restless, and that might be a direct indicator of hypoxia. Whereas an elderly person who's hypoxic and restless might be wandering, they might be picking at their bed sheets, pulling on their clothes. So you really need to understand how age can impact the question, right? So ask yourself, how old is this patient, and go from there.
Our next tip is airway is not the correct answer, ABCs, if it doesn't apply to the question. So don't fall for that trap, always thinking that ABC is the correct answer. You have to read the question and know your content to be able to get at the correct answer. So for example, if a patient is short of breath, before putting oxygen on, you want to put them in high Fowler's position and expand their lungs before you put oxygen on them. So in this question, ABC might not be the correct answer. Position would be the correct answer.
Exactly. Another testing tip is that although assessment comes before implementation in terms of the nursing process, you need to know those cue times of when you're actually going to just flat out call the doctor. Not everything requires further assessment. Some examples of that, we did do a previous video where we talked about when you call the doctor, knowing kind of the rules around that. We do have a whole prioritization section in our textbook that literally gives you the answer of when you actually call the doctor. A few examples might be after a cardiac catheterization, if a patient has chest pain, that is a medical emergency, you call the doctor. Another example, if I can think of one off the top of my head, might be if you suspect that somebody has compartment syndrome, you're not going to cut that cast off, you're going to call the doctor. So there's different examples of that you're not going to further assess. Although, yes, that is the nursing process, there are rules around when you call the doctor. You don't assess further. So you need to know what those are.
Our next tip is choose the answer where the nurse is immediately engaged with the patient. The patient is always number one. The patient's always treated with dignity and respect and caring. And that is demonstrated by you listening to them, you engaging them, finding a solution to what's going on with them, not giving advice, not judging, not ignoring.
Never agreeing and never disagreeing, which is difficult to comprehend. We do have a whole section on therapeutic communication and kind of the understanding around that. So you need to think about those principles all the time in every single question. The next tip we have is always choosing the answer that is the most patient-focused answer. Don't ever choose any answer that delays caring for the patient. So you're never going to go chart something before you do something for the patient. You're never going to go refer a patient to another department before you actually do something. That's called passing the buck or deferring responsibility on, right? You want to do the most patient-focused thing that you can possibly do. This includes assessing patients and not machines. So an example of that is if somebody's oxygen saturation is improving, the best indicator of that is not the O2 saturation on their finger going from 98 to 100. It is auscultating their lungs and their lung sounds being clearer and their clinical manifestations of oxygenation improving, because we go based on the patient and not the machines.
If you're looking to gain all the content, critical thinking, and confidence you need to pass your registration exam, we have complete NCLEX, NCLEX-PN, and CPNRE textbooks and packages. We guarantee you will pass or your money back. Thank you so much for joining us. We'll see you next time on In the Know.
Bye for
Bye
now.
for now.